pregnant in February. It was a very exciting time for us then. It was a very much wanted second baby. But things took a very different turn when I was about 14 weeks pregnant, and I went for a routine follow-up with my gynecologist. But indeed, a few weeks later, after they had carried out some further tests, they confirmed when I was 20 weeks pregnant that it was indeed invasive cancer. It hit me like a bolt out of the blue. I felt it was like I'd been hit by a truck. I was completely winded. I felt shocked, very shocked. You're at a very happy time in your life. You don't expect to receive news like this. And I started writing a diary, and I called it Heaven and Hell, because that's exactly how I felt. I was in heaven. I was so happy with the pregnancy, but this news was completely overshadowing it. But then I started thinking, well, what if it has spread? They're saying there's little chance, but there is a chance. For me, I was 20 weeks pregnant. I was very connected with the baby. I could feel the baby kicking inside me, but at the same time, I was obviously thinking of myself as well. For my husband, while this was a very wanted pregnancy, he obviously was very happy about the baby. For him, it was much more about me. We could have a situation where I'm left looking after our two children and you're not here. We had several difficult conversations about how we should approach this and what will happen if. And I started thinking, and I remembered I had seen a video when I was pregnant when I had been previously pregnant, a video, a presentation done by someone I work with, but at a TED conference, who had been talking about taboos in pregnancy.
Throughout the world, medicine is denying pregnant women their basic rights simply because they are pregnant.
One night when I was thinking all this over, this presentation came back to me, and I thought, well, maybe he's a good person to contact. There could be options out there. There could be other things that I could do, or paths that I could take, which would make it easier for me. And so that was really that was the first step to getting a second opinion, to getting more information. So I made an appointment with Professor Amant and his team. Yeah, the first thing he said was, "You can wait, but we don't have to." And that it felt like a weight was lifted. He said we can do some diagnostic tests, and that's the first step, and we'll take it from there. And depending on what that shows, we have the option to do this or this or this. And depending on what that shows, we can do. And all of a sudden, there was a plan laid out in front of me, and I cried at that appointment. But I was scared. I was very scared, but I think I was crying more of relief that there were options. Reactions from my family and friends were also shock. They had heard not so long before that I was pregnant, and now they were hearing that I had cancer and that I was going for surgery. And I think a lot of them said, "What? You can do that? That's possible?" For me, what was important was to have all that information in order to make that decision. What I'd like to be available for other people is that first of all, that they're aware that something can be done, because there is a taboo about taking medicine in pregnancy, about having any kind of treatment in pregnancy. And I had the same idea until I heard differently. Or until I looked for different information. So I think awareness within the medical community that it doesn't have to be a choice between the baby or the mother, that there are options out there, and ultimately somebody else presented with the same information as I got may have decided to go the same way as my first consultant advised, and that's okay too. But the treatment needs to fit the patient, and they need to be comfortable with what they're doing and what they're deciding. And for that to happen, they need the information to be available to them, and that for me is the most important.